eating disorder. So we say ed and not ED. And I hope you guys know what I'm talking about. Okay, get on with it. Okay, all right. Okay, I need some water. Hang on.
Hydrate.
My patients know I go through about 10 of these a day. And I tell them it's vodka, but seriously, it really is only water. Okay. Eating disorders. They may begin with a preoccupation with food and weight. And I know that everybody, when I introduce myself to people, they say, oh, so you're that diet doctor, or you're that food doctor, or something like that. No, I'm not a diet doctor. At all. No diets. I don't even want to start that because then I'll talk for another 3 hours and we've got way too many better speakers than me. But eating disorders are not about food and they're not about weight. However, people with eating disorders do start with a preoccupation with food and weight. But the food and weight are really just the vehicles of the underlying problems. They use food and weight as a distraction to numb the underlying issues. They're numbing their emotions. They're numbing all the things that are very uncomfortable for them. They are a manifestation of true psychological issues. They're trying to avoid them. So they engage in these food and weight things. They're trying, because as a control. The underlying common denominator in eating disorders is a control issue because they have a perceived sense of a lack of control in other parts of their life somewhere. I can't give you the answer for your son or daughter or mother or father or husband or wife. Why? That's what therapy will help with, okay? But they obviously think that they can control their weight, control their body, control the food in or out, but they really end up spiraling out of control. They go to extremes to control the one thing they can. Food in, food out, what to do with it once it comes in, how much they consume, so on and so forth. The cycle becomes very addictive for them, and it's like a high. It's like an addict's high, and it spirals right out of control. But while they're in this cycle, the patient, the victim, they believe that it's all about their weight. If you ask somebody that has an eating disorder, they're going to tell you, if only I could just lose 5 more pounds. I mean, those of you that have experienced this, you'll know they're focused on their body. They're focused on their weight. I could just lose 5 more pounds. Well, just 2 more pounds. Well, 1 more pound. If I could just get down to this, to this, to this. Oh, well, I just want to be a size, dot, dot, dot. You fill it in. I don't talk about numbers in here anywhere. But I'm sure some of you in here, at least half of you probably have heard that. 1 more pound, 5 more pounds. There's no magic number here. They can be, 50 pounds if they're still alive, and it's not enough because it's not about the weight. It's never been about the weight. Eating disorders are complex conditions. They arise from a combination of long-standing behavioral, biological, emotional, psychological, interpersonal, and social factors. Scientists are still learning about the underlying problems, the causes of the emotionally and physically damaging conditions. We do know that there are some general issues that contribute to the development of the eating disorders. Some of them are psychological. Psychological issues are things like low self-esteem, feelings of inadequacy, or like I mentioned before, the lack of control in one's life, depression, anger, anxiety, loneliness, things like that. Some of the interpersonal factors that contribute to eating disorders include troubled family or interpersonal relationships, difficulty expressing emotions or feelings, a history of being teased or ridiculed based on the size, shape, or weight, a history of physical or sexual abuse. Scientists are still researching the possibility of biochemical or biological causes of eating disorders. They do know one thing, that eating disorders do run in families. There are significant genetic contributions to eating disorders. This is when we get to some social factors. I'm sure all of you know, I'm going to elaborate on this because I've done a lot of media, a lot of radio, a lot of interviews for newspapers, magazines, and the one thing that reporters always seem to ask me is about our culture and about media. And so, you know, our cultural pressures, we have a lot. They glorify thinness. We can't escape it, basically. Our culture values being skinny, the perfect body. I know I don't have to explain that to all of you. We see it everywhere. We're bombarded. Our culture places value on physical appearance, like our shell, rather than any of our internal attributes. And as a clinician, especially a clinician in the tri-state area where there's really a lack of help for eating disorders, I sit there hour after hour trying to help my clients really try to understand that we are made up of so much more than our shell. But it's really hard to convince people of that when we're bombarded with hundreds and hundreds of ads every day that say that we just have to look better on the outside. So our culture, our culture plays a big role